Free flap is the name given to a specific technique of reconstructive surgery. In this video, we will discuss why it has to happen and also your recovery and outcomes. Here we are discussing facial reconstruction after the removal of a large tumour. In some cases, vital structures are removed along with the tumour. This leaves a large wound site which cannot be stitched closed. As a result, we need to use tissue from another part of the body to fill the defect. In this example, the upper leg is chosen to provide a flap of tissue needed for facial reconstruction. This may be composed of any combination of skin, connective tissue, muscle and bone, and is still linked to a major vein and artery. It is removed from the thigh and transplanted to the facial wound site. In order to ensure this transplanted tissue survives in its new home, its blood vessels are stitched to blood vessels in the area being reconstructed. The artery brings fresh blood supply to the tissues while the vein removes it. This is very fine, fragile work performed with the aid of a microscope. Free flaps are used to restore the appearance and function of the surgery site. The goal is to provide a reconstruction that allows you to return to optimal functioning and restore a high quality of life. In addition to your wound site, you will also have another wound where the tissue has been taken from. Sometimes it's possible to close these wounds with stitches to create a linear scar. But sometimes a skin graft or a shave of skin is needed from another area if the flap removal site is too large. Free flap surgery is a complicated procedure and it does require a stay in hospital. This usually includes a short time in the intensive care unit, followed by several days to weeks in a post-surgical ward. Throughout your hospitalisation, we will very carefully monitor blood flow to the transplanted tissue. During your stay, many different caregivers will be involved in your recovery, such as speech and language therapists, physiotherapists and occupational therapists. They will all look after different elements of your rehabilitation. In certain cases, you may need to have teeth removed if the flap is positioned inside your mouth. This may be done before your surgery by a dentist or during your surgery. Free flaps can be used to reconstruct areas at the back of your mouth or at the top of your throat, and this can affect your speech and/or your swallowing. Sometimes temporarily, but often permanently. Your surgeon will discuss these changes with you before your surgery. If these are likely to be affected, you will be assessed fully by a speech and language therapist and a dietitian. They will work together to ensure that you still receive all of your necessary nutrition and to help you recover so that you can communicate with your loved ones and medical staff. Depending on the area reconstructed, you may need a feeding tube while you are healing, or a tracheostomy to ensure safe breathing. Some patients may require further treatment in the form of radiation therapy or chemotherapy, which would mean a longer stay in hospital. A facial free flap reconstruction is done in the best efforts to reconstruct normal facial features, but they will never return to their original state. The result is what we consider the next best thing in order to heal and function. Most free flaps are usually numb and don't regain feeling. Some patients find this very difficult to get used to. Talk to your surgeon about any concerns and wishes you may have in this regard before your surgery. But there is no doubt that the area is going to look and feel very different. To give you a sense of what it might look like afterwards, your surgeon can show you some photographs. These will help explain how your flap might look, and you can ask any questions you might have. Because the stitching of the artery and vein is such delicate work, it is really important that the area is kept safe after surgery. If there is an issue with the blood supply, in most cases you will need an emergency operation to inspect the area while you're asleep under anaesthetic. The surgeon might revise or adjust the flap if you need this. Other risks of the procedure include infection in the area, impaired healing and bleeding, as well as general risks that come with any major operation. These include chest or urinary tract infections and clots in the legs or lungs. There is also a risk that you could feel very unsatisfied with the results of your procedure. In certain cases, if suitable, you may be offered a prosthesis to replace certain missing facial structures. It is really important to wait, recover and adjust before making any firm decisions about this. It may take time to feel comfortable with your new appearance. The benefit of having free flap surgery is that when healed, it provides a strong cover over the area. This helps the area heal better and reduces the risk of infection. It also gives you the best chance of being able to get back to eating, speaking and living well after your surgery. This will give you the opportunity to regain function and a high quality of life.